And good afternoon, everybody. Welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Bhavya Suri, health educator at MS Focus, and I'm joined by Dr. Terry Wahls, who's here to talk with us about updates on dietary research. After her presentation, we'll open it up to your questions and comments. Now, I'm delighted to introduce our speaker, Dr. Terry Wahls. She's a clinical professor at the University of Iowa, where she conducts clinical trials that test the efficacy of therapeutic lifestyle to treat multiple sclerosis related symptoms. Additionally, she's the author of the Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles, and the cookbook, the Wahls Protocol Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. Quite the publications. We're pleased to have her join us to present this important topic. Dr. Wahls, thank you for being with us today.
Great, thank you for having me.
So we're going to do this in an interview style. I'm going to be asking Dr. Wahls questions, and she'll be answering them. And then at the end, we'll open it up for Q&A for everybody. So are we ready?
Absolutely, let's go.
All right. So can you tell us a little bit about yourself and your background, please?
So I'm a farmer's daughter, grew up in Northeast Iowa, went to medical school, and it was actually during medical school they started having symptoms of electrical pain that would later be diagnosed as trigeminal neuralgia. And 20 years later, when I was 45, I developed weakness in my left leg, saw my neurologist, said this could be really bad or really, really bad. And so I was thinking about my electrical face pains as I went through my workup for the next 3 weeks. I was diagnosed with MS. I did my research, found the best MS center in the United States, saw their best physician, took the newest drugs, including Dietary. But I went relentlessly downhill. 3 years later, I'm in a tilt recline wheelchair. And my face pains are getting continually worse. My 10-year-old daughter hugs me as tears stream down my face. And that's when I start reading the basic science. And I decide that mitochondria are the driver of disability. And I create a supplement cocktail to support my mitochondria. The speed of my decline slows. I'm very grateful. I discover a study using electrical stimulation of muscles. I ask my physical therapist if I can try that. He gives me a test session. It hurts bad. I mean, really quite bad. But when it's over, I feel great. He tells me it's because of the endorphins. And so we add e-stim to my physical therapy. Then I discovered the Institute for Functional Medicine. I take their course on neuroprotection. I have a longer list of supplements. And then I have an aha moment. And actually, I'm sort of embarrassed as to how long it took to have this aha moment. Because I've been following the paleo diet already for about 5 years. But now I think, what if I redesign my paleo diet based on this long list of supplements that I'm taking? So that's more research, but I redesigned this new paleo diet and I start this new way of eating December 26, 2007. For context, at that time, I can take a few steps using 2 walking sticks. Otherwise, I'm in the tilt recline wheelchair. I cannot sit up in a regular chair anymore. If I sit more than 10 minutes, I am so exhausted I can't function, and I'm on bed rest for 24 hours. I am still staffing clinics for the residents from my zero gravity chair where my knees are higher than my nose. And I know I'm about to have to take medical disability because I'm beginning to have brain fog. I start this new way of eating December 26th. At the end of January, my fatigue is markedly reduced, my mental clarity is markedly improved, and my physical therapist says, Terry, you are getting stronger. I'm advancing your exercises. So now I can do, and I had been limited to 10 minutes of exercise once a day. Now I'm going to do it twice a day, then 15 minutes twice a day, then 20 minutes twice a day, then 30 minutes twice a day. I'm doing more e-stim. And I began walking with my 2 walking sticks at the hospital. People are stunned. Then I began walking without my walking sticks. They're stunned again. Then I tell my family I want to try riding my bike, and Jackie says, that's my wife. Maybe in the fall if things keep going well. Well, 2 weeks later, I really want to try riding my bike. It's Mother's Day. So we have an emergency family meeting, and Jackie tells my son, who's a big boy, 6'5", Zach, you jog alongside on the left. My 13-year-old daughter, who's 5'6", you jog alongside on the right, and Jackie will follow. So um, we all get in position. Jack gives the all clear, and I get on my bike, and I bike around the block.
Wow.
And that big 16-year-old boy, he's crying. My 13-year-old daughter, she's crying. Jackie's crying.
I might cry right now. So
And I cry when I talk about it. Because, at that moment, that's when I began to understand that the current understanding of progressive multiple sclerosis is incomplete. And
Mhm.
who knows how much recovery might be possible. So I began biking a little more every day. And in October, Jackie says, I'm signing you up for the Courage Ride. It's 18.5 miles. However far you go is going to be great. And at that point, the furthest I had biked was 8 miles.
Mhm.
So I biked 18.5 miles that day.
Oh, wow.
My kids are crying, Jackie's crying, I'm crying once again. And of course, this really changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of my research. And it's my mission to teach people, like everyone who's listening, that there's so much you can do that will change your disease course. And it's my mission to change the standard of care, which is why I am so passionate about the research that I do. Because if we're going to change the standard of care, we have to have published peer-reviewed clinical trials that show, in randomized controlled trials, that the intervention is helpful and it's better than usual care. So anyway, I'm thrilled to be able to chat with everyone here and to give hope to all of you who are listening, because if I can come back from horrific levels of pain, beginning to have brain fog, unable to sit up, struggling to walk even just a few feet with my walking sticks, to the point where this morning I jogged 20 minutes on my treadmill. 20 minutes, folks. It's pretty exciting.
I think I speak for everyone when I say that's beautiful. I think that's the best way to put that. Thank you for sharing that. That was quite the journey.
Yeah, I have to wipe my nose here. I
No, it's
I,
okay.
I can't
I pushed my tears backwards, but thank you
I,
so much for sharing that.
I can't tell that story without crying. And I doubt that I ever will be able to.
And that it's your journey. That's completely understandable. Thank you. I think that definitely gives hope and motivation to a lot. Are we ready for the next question?
Absolutely.
Okay. Prior to the new clinical trial that you're conducting, you have been the author of two other studies, review of two popular eating plans within the multiple sclerosis community that discuss the low saturated fat and modified Paleolithic diet, and also the dietary approaches to treating multiple sclerosis related symptoms. Can you discuss the findings briefly that you had in each of those?
Yeah, so when I analyzed the menus for the slow saturated fat diet, basically the swank diet, and the menus that we had in the Wahls protocol, we're able to show that both of those diets are nutrient dense, vastly better than the average American diet. Uh, and so that certainly addresses a lot of the concerns and pushbacks that we have from many registered dietitians and people within the neurology community that we're creating harm when in fact we're improving the nutrition for those folks. So that was the first question. Could you remind me what the second half of the question was?
So it was just both of your studies. One was the review of two popular eating plans, and the other was the dietary approaches to treating MS related symptoms.
Okay, so the dietary approaches. Um, so that paper was about our study protocol, where we're going to have, and let me explain, people come in, we do all of their assessments, and then we ask them, don't change your diet, don't add anything new, and we will bring you back in 12 weeks and we'll repeat all of the assessments. So that's to see if the measures are stable,
Mhm.
if they spontaneously improve or not. And the measures of walking, hand function, vision function, working memory, they were all stable. Measures of fatigue and quality of life, they were stable. Then we randomized them to either get the Swank diet or
Mhm.
the Wahls diet, and they got 5 calls from the dietitian. Then they came in at 12 weeks, and we repeated all the measures. Then we send them on their way. And we brought them back in another 12 weeks. And here the question is, could they keep up the good diet?
Mhm.
And we repeat all of the measures. And so we're able to look at how much did things improve in the first 12 weeks and how much did they improve in the second 12 weeks. So we got a look at what 6 months of the Swank diet and 6 months of the Wahls diet will do for people. And do you want me to tell you that now, or is that coming in a follow-up question?
That was part of it. What did you find in the
Okay, like I am so excited. So, really the best thing that we could have possibly have found is that both diets are helpful. And that is what we found, is that the Swank diet reduces fatigue, improves quality of life, mental health quality of life, and physical health quality of life. Now, in some of the measures, the Wahls diet was more effective than the Swank diet in terms of the more sensitive fatigue measure called the Modified Fatigue Impact Scale. The Wahls diet was significantly uh, more effective than Swank at a p-value of 0.05. And then the mental health and physical health quality of life at 12 weeks, the Wahls diet was significantly improved. The Swank diet was not, although it was improved by 24 weeks. Um, the Wahls diet, again at a p-value of about 0.05, was different from Swank, so it was more improved. However, I want to be very clear that if the Swank diet speaks to you, and you're worried about saturated fat, you would rather do the Swank diet. The Swank diet was helpful. So I don't want to bash the Swank diet. It's a good diet. We did improve it by telling people more explicitly to eat more vegetables and more explicitly to reduce processed foods and added sugars. So if you'll do that and follow a low saturated fat diet, I think Swank diet is a great diet. If you do the modified paleo diet, and let me sort of give people the overview for that, I took the standard paleo diet, getting rid of grain, getting rid of legumes, um, eating meat, and I said, you don't need to eat quite as much meat, but you need to eat a lot more vegetables. I want you to have 3 platefuls of vegetables, measured raw, and that's what I want you to consume in the day. Now, in my clinics at the VA, we're mostly men. So these are guys, 9 cups of vegetables, measured raw is not a burdensome for them.
right?
Petite women, 9 cups of vegetables, measured raw, might be too much for you. So for women, we might need, 6 cups. So if you're tall like me, 6 foot tall, 9 cups is still pretty easy to do. But if you're very petite, 4 foot 11, 5 foot 2, 6 cups is probably better. And we're talking about 3 cups of green leafy vegetables, 3 cups of what I call the sulfur-rich vegetables, cabbage, onion, mushroom family vegetables, and 3 cups of deeply colored beets, carrots, berries. The reason I'm so keen on greens, carotenoids, vitally, those are the pigments in those green leafies. They're called zeaxanthin, mesozeaxanthin. They're super important for protecting your eyes from ultraviolet light. And they turn out to be super important for protecting your brain cells as well. And then they have a lot of vitamin K in them that our bacteria will metabolize further into the more active forms that our brain and our bones and teeth need. And we know that these compounds, the vitamin K, appears to be, at least in animal models, very helpful in repairing myelin. Greens are also a great source of calcium and magnesium, two important nutrients for the brain. Now, for the sulfur-rich, the blood vessel health greatly improved with the cabbage and onion family vegetables, and it will boost intracellular glutathione. These are important antioxidant compounds, um, uh, really protective for our cells and our brain cells. Mushrooms, we know the more mushrooms you eat, the lower the rate of anxiety, depression, and dementia.
I did not
So
know that.
everybody should have mushrooms. Like, I really want you to have mushrooms several times a week. Fabulously good for you. And then color, the more color you eat, the lower the rate of diabetes, the lower the rate of cancer, the lower the rate of obesity. Again, really important to comorbid problems. We need to have sufficient protein. We want people to eat meat, fish, poultry, and ideally you want to have 0.8 grams of protein per kilogram. So 6 to 12 ounces of meat per day will generally take care of that. We also wanted people to have sufficient vitamin D to get their vitamin D into the top half of the reference range. And we gave them a multivite, some fish oil, and I think that was all of the supplements that we were giving. Oh, we gave them methyl B12 and methylfolate in addition, because we know high homocysteine is more prevalent in people with MS, and if you have high homocysteine, more likely to have cognitive decline. Now, the other observation that I want to go back to is that we told people to not add additional exercise unless their physician had specifically sent them to physical therapy or gave them very specific instructions to exercise more. So at 12 weeks, neither group's walking endurance, that is how far they could walk in 6 minutes, changed. But at 24 weeks,
Mhm.
again, the Swank group, their walking endurance did not change. The Wahls group did change, and it met clinically significant differences, although the p-value between the difference between that and Swank was only 0.08, so not statistically different, but certainly very interesting that walking changed. And we're still writing papers. We still have more data to analyze. So there'll be more papers that I can discuss the next time I come back about that paper, about that study.
Thank you for sharing all of that. In your opinion, why don't all neurologists discuss diet and the role that it can or may play in multiple sclerosis?
Well, I tell my medical students and I tell my postdocs, it takes about 30 years to change the standard of care. You need to have a lot of peer-reviewed published research. We present it, and we've been doing that. We've been presenting it at the MS research meetings that happen. We present it at the Consortium of MS Centers, which is the big clinical meeting that happens every year. And as a matter of fact, we'll be giving 6 oral presentations at that meeting, and we have 4 research abstracts that we've submitted, and I have another research abstract that we'll submit. I'm presuming that they'll have a late-breaking abstract because we have some new, really interesting results to submit. It takes a lot of work to keep up. So the old farts don't keep up because they're busy with kids and everything else. It's hard for them. But I do want to tell you about a really interesting study that was just published January 24th. There are now 12 dietary intervention studies that are happening. The study that we did in 2010 was one of the first, by the way. But we now have 12 that have been randomized and controlled. And there's a process called a network meta-analysis, where you are able to standardize the mean differences between the between the two diets, whether it's a control diet and the intervention diet, or two intervention diets. And then they looked at the effect of the diet on fatigue, on quality of life, mental health, quality of life, physical health. And when you do a network meta-analysis, you're able to sort of rank order the diets so that you know which diets are the most effective and which are the least effective. And we've been doing this for a long time to figure out which disease modifying drug treatments are the
Mhm.
most effective and the least effective, and which has the most serious side effects and which have the least side effects. So we've been knowing how to do this for quite some time. There were 8 diets that got looked at. The low sat diet, low saturated fat diet, which was look at the Swank diet and the a McDougall diet. The Paleolithic diet, and these were all studies that we had done. So the modified paleo diet, basically the Wahls diet. The anti-inflammation diet that was done in Iran, the ketogenic diet. Now we've done some ketogenic diet studies, and a group in Germany has done ketogenic diet studies. And then Mediterranean diet studies that Alana Katz-Sand does, and a fasting study and a calorie restriction study that Kate Fitzgerald's done. And there were 608 people in all of those studies. So they're still fairly small studies, but it's very exciting. We had 608 folks. And there were 3 diets that reduce fatigue: the
Mhm.
paleo diet, Mediterranean diet, and the low-fat diet. There were 2 diets that improve quality of life, mental health, and physical health. That's the paleo diet and the Mediterranean diet. And there's a particular figure called a forest plot that makes it visually easy to understand. You have the dot where the mean difference, so the mean improvement, the 95% error confidence interval, which tells you the truth of the matter lies somewhere between these error bars, and the center line is everything to the right favors the intervention, everything to the left favors the control. And so if your mean benefit and the error bars are all on the side favoring control, then you can say that diet definitely helps reduce fatigue or
Mhm.
improves quality of life. And it also lets you know which one is the best, which one is the least effective. So no surprise. Um, well, actually, it's probably not surprising in some ways. The calorie restriction was the least effective. People were more fatigued,
Right.
and that's pretty tough to sustain.
Mhm.
Fasting was also tough to sustain. The anti-inflammation diet was sort of just was not that helpful. Ketogenic diet um, was helpful, but the error bars crossed over, so you couldn't say it was definitely helpful. The low-fat Mediterranean and paleo definitely helpful, but it's quite striking. The paleo was uh, about twice as effective as Mediterranean or low-fat on reducing fatigue. And then on quality of life, again, what was helpful was paleo and Mediterranean. The paleo was about twice as effective as Mediterranean. That came out in neurology, the highest impact journal that nearly every neurologist who sees MS patients gets and hopefully read.
Right.
And then hopefully they also read the editorial by 3 highly respected dietary intervention researchers whose studies were not part of what we reported on,
Mhm.
or what Dr. Spencer reported on, rather. And they said there is very good evidence that diet matters, that diet can reduce anxiety and can improve quality of life, and that every patient who's newly diagnosed or has been diagnosed should go see a nutrition professional and be told that diet matters. They should be encouraged to follow the Mediterranean diet, the paleo diet, or at the very least, dietary guidelines for Americans, and that we should work with patients so they implement a diet that they and their family
Mhm.
are can do together as a family.
Okay.
So I'm like so excited. I am so excited. We're halfway there, folks.
Right. And I'm sure doing all these studies is definitely helping.
Mhm.
Um, how can someone with, I know you just mentioned it, that nutrition is important in talking to dietitians. So, with that said, how can someone with MS go about getting a referral from their healthcare team so that they can discuss
Well,
their food habits with
so
a
there's a couple ways you can do this. So you could ask your primary care person, would you please give me a referral to a dietitian? And you could, if you have high blood pressure, obesity, diabetes, prediabetes, that's a Medicare approved indication for a visit with a dietitian. And for it depends on your health insurance plan, will that be covered? But for many, that will be a covered service. Yeah, and there are other nutrition professionals out there that uh, let's see, licensed clinical nutritionists. They can also provide some nutrition information as well. But certainly the registered dietitians. And what I want you to do is talk to your dietitian. Say, I'm intrigued with the paleo diet. Help me do that. I want to do a Mediterranean diet. Help me do that. I'm really intrigued with the ketogenic diet because I'm really overweight and I hear it's good for weight loss. I'd like to do that. I'm intrigued with intermittent fasting. I want to do that. So it's fine to come with what interests you have, and hopefully, hopefully, we can send you the link, and I'll show you the link in PubMed to this article, so you can at least see the abstract. So the abstract should give you confidence to go in to talk to your neurologist and say, hey, this was in neurology. It says that diet really matters. So the paleo diet, the Mediterranean diet, and the low-fat diet are all good. And I want to try one of them. And your neurologist can no longer say diet doesn't matter because it was in neurology. The journal that your neurologist will agree is a journal with really great science.
thank you. I was actually going to ask if you could share the article or if it research or results are public so that
So
people.
yep. So I don't get to share the PDF, but I can share the link to the PubMed abstract. And so if you share that with everyone who attended, they can read that abstract, and then they could print out the abstract, take it with them to their neurology visit and to their primary care visit for that matter, and say, I want to see a dietitian to talk about these 3 diets, and I got to pick one of them.
Right, that would be great. Thank you. Can you tell us about the new clinical trial that you are conducting?
Oh, I am so excited
Me too.
about this. So again, because I feel so passionate about doing diet and lifestyle research and changing the standard of care, one of my grateful patients funded this study. It will let us follow people for 2 years, and you have to be willing to come to Iowa at month 0, month 3, month 24. You must have relapsing remitting multiple sclerosis and be between the ages of 18 and 70. At baseline, we'll collect some blood and saliva. We will have you walk, check your hand function, vision function, and a very easy measure of thinking function. We will also ask questions about fatigue, quality of life, anxiety, and depression. We will get a research MRI, so there's no contrast. It's just a little bigger magnet, and we'll measure your brain volume. And we'll do that at the beginning, and we'll do that again at the end.
Mhm.
The questions that I'm asking are, number one, can fixing your diet lead to reduced fatigue, improved quality of life, and better function? And then I think the most interesting question of all is, can fixing your diet lead to, well, I should back up for a moment. All of us who have MS, as a group, our brains are shrinking 3 times as fast as occurs in someone who has healthy aging, about 1% per year, which is why people with MS have higher rates of becoming frail, higher rates of anxiety, depression, higher rates of dementia in early nursing home care. In my clinical experience, because people have such great improvement on mental clarity, and we could also have the chance to look at my brain volumes, which are continuing to be very, very good.
Mhm.
I'm very optimistic that brain volume will get back to healthy aging, which is why we have to follow people for 2 years and get these brain volumes at the beginning and at the end. Now, the diets that we're studying are the modified paleo diet, basically the same diet in the study that I just described, and a time-restricted olive oil-based ketogenic diet. A lot of the ketogenic diets really lean into dairy, eggs, and full-fat dairy, which is very high in saturated fat. I want to have something that's more heart-friendly because I'm an internal medicine doc. I care about hearts. So, so we reduce the saturated fat and we stress olive oil. And then if people have a an elevated cholesterol, we don't let them have all that dairy, and we just lean into olive oil. And because we're using olive oil as opposed to coconut milk, we time restrict the eating so that there's a eating in a 6 to 8 hour window, which makes it easier to get into ketosis. The control diet is the usual diet. So for all of you who are listening to me, hopefully you've been inspired that you got to fix your diet. And we know that people who do diet studies agree to do diet studies because they want to fix their diet. So the control arms always fix their diets. And the control arm never has a diet that's as bad as the standard American diet. And I expect that will be the case in our study. So again, if you are listening to me and you screen, you want to be in my study, and you fix your diet, you're doing whether it's the low saturated fat swank diet, Wahls diet, or a keto diet. What you have to be willing to agree is when we randomize you to one of the arms, if we randomize you to the keto arm, you're going to do the keto diet. If we randomize you to the paleo diet, you're going to do the paleo diet. And if we randomize you to the usual diet, you get to do your usual diet. And if you already fixed your diet, that's okay. We aren't going to ask you to make your diet bad, which is why I think my question is, can I get people to healthy rates of brain aging is the most important question we're asking in this study.
Mhm.
And if all three groups get to healthy aging, that'll be extraordinary because if you take drugs do the DMTs do a very good job, particularly the high potency ones, of stopping relapses, of decreasing the number of enhancing lesions. They do not do a good job of preventing fatigue, preventing anxiety, preventing depression, preventing conversion to needing a wheelchair, preventing dementia, and preventing nursing home care. You got to stop the brain atrophy to do those things. And so, and they don't do a very good job of stopping brain atrophy either. If we are able to show that we can do a good job of stopping brain atrophy, the manuscript for that paper will be in neurology. And I'll be on NPR.
Oh, I listen to NPR. I will be waiting for that podcast. Uh,
Okay.
so next question, you kind of already answered it. What are the benefits of joining this clinical trial?
Well, the benefit is that if you are in the randomized 2 intervention arms, you'll get a couple calls with the study dietitian who will help you understand how to implement the diet given your culinary preferences and what's going on with your family. And you'll have monthly calls with the study dietitians. You get to submit questions, and I create videos for the answering the questions for the 2 intervention groups. And there is an app, a diet app that we have for the intervention groups to give them some tips on how to meal plan and make this work for them. In the
Mhm.
control group, we have a app for them as well. It's the app for dietary guidelines, and we have a monthly email, text that will have cooking videos and tips for getting the added sugar out of your diet, reducing the processed foods. So you're getting contact with our study team with tips once a month, or you're getting contact with an opportunity to be part of a group call once a month. And you get to know that you're helping change the standard of care. You're helping make it better for the 2.8 million people with MS around the world.
Right. How would people go about registering for your study?
So we will send out the study brochure afterwards, and you'll have on the brochure, there's a hot link that will take you to a screening survey. You can also go to Terry Wahls, Terry, Wahls, WAHLS.com, and there is a gold bar across the top, and click there. You have to take a screening survey that will answer a few questions and will give us your email so we can contact you in case you filled it out wrong. And you'll be surprised at how many people do. So we have to follow up.
Right.
And then we have to contact you to get permission to contact the neurologist who has to verify the MS diagnosis or send me the medical records so I can verify the MS diagnosis. And then we'll begin the process. We're recruiting 156 people. My study team told me that we have 75 people in. So basically, it's about 81 people that we have to recruit left.
Mhm.
And the other thing I want you to do is to sign up for my newsletter, terrywalls.com. And the reason I want you to do that is every week I look at the research that's coming out, and I'll pick 2 or 3 studies, and I'll have a very short commentary about those studies, what they mean, and I look for studies that speak to me in terms of what are the things that we could be doing, either supplement wise, diet wise, exercise wise, meditation wise. So things that are under our control that can help us have a better outcome.
Thank you. Will you be hosting any other conversations about this clinical trial in another platform?
Well, one of the things that I'm going to be doing is a MS and Neuroimmune Summit, July 5 through 11. And I'll be interviewing other clinical experts, researchers, neurologists, and we'll be talking about basically things that people can do under our control that could help us have a better outcome for MS and for other autoimmune things that wreck our brain, wreck our spinal cord, wreck our peripheral nerves. And there's actually quite a few things that can do that. But there's also many things that we can do that you may not be aware of that could help us have either a better quality of life or reduce our symptoms. I have 40 people scheduled. My team told me that I've invited another round of people, that I'm up to 50. I need to stop inviting folks. So I will do that. But this is free. It's online. If you sign up for my newsletter, you will for sure get the announcements. We will put this out. We'll start promoting it for people to sign up the week of June 20th, because otherwise we all forget. So we tell people about it just before it happens. But I'm super excited. I think it'll be really very helpful, and it's
I,
free.
and you said people can sign up for your newsletter on your website,
Yeah,
correct?
if you go to terrywalls.com, and you could put /email. I think that's the link. But if you just go to terrywalls.com, you could scroll down, and there'll be a place for you to sign up.
Sounds great. Well, now we are ready for questions. If you have a question or a comment, you can ask it using the Q&A button in the app. That allows you to send your question anonymously, if you choose to do so, or you can ask your question live by raising your hand. If you would like to, click the raise hand button or press *9 if you are using your phone. I will call on you and then you will be able to unmute and ask your question. Are we ready, Dr. Wahls?
Okay, let's go.
All right. Christine is asking, I've been trying to eat along the lines of minding your mitochondria for years, and it has helped some. Any advice about how to actually consume those 9 cups of vegetables every day? I can't make a huge salad every day.
You know, so I would encourage you to pick up the newest version of the Wahls protocol. I've had some more refinements to my thinking, so I would do that. The other thing I want to remind everyone is this is where you start. When you write a book, we put out sort of a public message for everyone. If you came to see me, I could personalize it. I would know how big you are. I would know your other medical issues, and I could make a much more specific recommendation. You don't need to eat beyond your appetite. I get a bit distressed when I see people struggling to overconsume beyond their appetite. Our appetite is really tightly regulated by our brain, and so eat the correct foods, have protein, have your greens, your sulfur rich, and your color about in equal proportions according to what your appetite is telling you to eat.
Thank you. Anonymous is asking, when I ask my neurologist about the diets, the response is always there's not enough data to support the diets to make any clinical difference. What do you think about that?
Well, I think you're going to get this great abstract that was published in Neurology, and I encourage you to print it out and leave a copy with your neurologist to say, well, there is evidence, and I want a referral to a registered dietitian, and I expect that my health insurance would cover that. So please give me a referral. And if your neurologist won't do that, then ask your primary care doc. And at the very least, pick up my book and read it, be inspired.
Thank you. My dog is excited. Sorry. Sherry from Facebook is asking, how do you feel about stopping disease-modifying drugs?
So if we stop disease-modifying drugs, predictably, you can expect a severe rebound and severe flare. So I have patients ask, um, when is it safe to stop the drugs after implementing diet and lifestyle? I'm doing really well. I've not had any relapses. My neurologist tells me that I don't have any enhancing lesions. When is it safe? And part of the problem is there is no research. There are some disease modifying drug stopping studies going on. And actually, I've written grants to, to investigate this. I propose that we take people and randomize them and have everybody get diet and lifestyle, follow them for 6 months, and have half the folks stop the drugs and half the folks stay on the disease modifying drugs. And then we could know, did the diet and lifestyle reduce the risk of rebound? I was not funded. What was funded was people could just either stay on the drugs or stop the drugs. And we did nothing to reduce the risk of rebound. And of course, I'm looking at that, I'm thinking like, that's a terrible, terrible design because you're not trying to protect people. We know that, clinically, other functional medicine, integrative medicine practitioners are seeing that people get great response. The vast majority have reduced fatigue, improved quality of life, the relapses stop, and the number of enhancing lesions basically stop. We don't know how long you have to watch. I tell my patients that we don't know. My preference is that they wait at least a year preferably 18 months before trying to transition to a less potent disease-modifying drug, such as Tecfidera or Copaxone. And then they could decide, do they want to try and go off of that. I'll also tell you that and my integrative functional medicine folks will see people after a year decide, you know what, I feel great. I'm not taking those drugs because I'm more worried about the side effects from those very potent disease-modifying drugs. Um, it makes me uneasy, but uh, until we have research, the kind of research that I'm proposing, we're not going to have any clear answer. What we probably need to do are find a way to get a case series going of people who have implemented diet and lifestyle successfully,
Mhm.
had no relapses, no enhancing lesions, stopped their DMTs, followed for a year, and that they've had no relapses, no enhancing lesions. Uh, uh, that would be ideal, and that's what we need to have happen next.
Thank you. Elizabeth is asking, any thoughts on the overcoming MS diet, which is essentially swank with more veggies plus fat flaxseed oil and or limited fatty fish?
You know, I am so glad that Overcoming MS was inspired by my book and made those changes. I am so glad. And so I think that is another diet. And if you have high cholesterol, you're worried about heart disease, that's a fine diet to follow. It's basically a low saturated fat version of the Wahls diet. And I'm fine with that. If I do want to make the observation that cholesterol is a big part of our cell membranes, is a big part of our brain, is a big part of myelin. And if your cholesterol is less than 180, you have a much higher rate of suicide, homicide, anxiety, depression, dementia, cancer, and chronic infections, including Lyme's disease. So if your cholesterol is over, and the lowest all-cause mortality is at 225. Now, if your cholesterol is higher than 200 or 225, you have a lower rate of all those diseases that I just listed off, but you have a higher rate of heart attacks, higher rate of stroke. So when I'm meeting with my patients, I'm understanding their neurologic issues, I understand their cardiovascular issues, and then we have and the risk of diabetes, and then we have a conversation for them. What is the optimal cholesterol for them? And then we make recommendations based on that.
Thank you. Sasha is asking, can you translate the measurement of 3 cups into recommended grams or ounces?
So, do you have a dinner plate? A dinner plate is 3 cups. And so the amount of, so no, I don't have a gram because this will depend on the type of vegetable that you are measuring. Instead of being focused on grams, I want you to think about your dinner plate, a dinner plate of vegetables. The goal is if you're 6 foot or a man, it's three plates. If you're female and petite, it's 2 plates.
I have to start eating more vegetables. All right. So I'm going to allow Rob to talk. He has his hand raised. Rob, can
Great.
you hear us?
Yes, I can hear you. Thank you. Can you hear me?
We
Yes.
can. Beautiful sunset.
Okay, great. Um, Dr. Walls, wow, this was so timely for me because I was diagnosed 4 years ago, late in life when I was in my early 60s. And I actually read your book somewhere near that time when I was diagnosed. and then didn't do anything about it, and recently got it on audio tape, and so I've been listening to it, you know, every day that way.
Excellent.
So this presentation was really, really timely for me. A lot of the couple of questions I had about your research to date, you already answered with the other folks. The only other question I have is I have PPMS. That is my diagnosis
Yeah.
and my only diagnosis at this point. Am I eligible for your study?
Um, no, we only let relapsing remitting in. However, please screen so you're in our database, because I'm writing grants and proposals for progressive MS, and we would love to have you in those studies.
Okay, very good. And screen
Oh,
by screen, you
and
mean?
so if you go to terrywalls.com, there's a gold bar across the top, and they'll say click here to take the screening survey. Click that spot and complete the screening survey.
Okay, wonderful. Thank you.
Thank you.
Thank you, Rob. Okay. Before we continue, Dr. Waltz, do you mind sharing the link? I noticed that a lot of people are asking for the abstract article link. If you could please send that.
Okay. Now this is going to be a little tricky.
If you want to email it to me later, we can do that too, and I can send it to everybody that registered, if that's
You
easy.
know, so that will be easier. So I don't mind looking for it, but keep in mind while I'm looking for it, I am not going to be able to answer questions. So
We
you
can
can
do that,
decide.
and I can send it to everybody that's asking. I will send the abstract link to all of you via email from the registration email that everybody got. So can we proceed to
Yeah,
questions?
please.
I also don't want to take up time on something that can be done later. Elizabeth is asking, is the type of mushroom going to matter?
Yes, it needs to be something you can eat. There are plenty of poisonous mushrooms, so don't go out into the woods and start picking mushrooms willy-nilly. You need to be sure that they're edible mushrooms, and so either get them in a grocery store or from a very knowledgeable um, uh, mushroom expert.
Thank you. Next question is, Christine is asking, what about dairy?
So for about 200 million years, mammals have been raising our young with milk. Very effective at growing infants rapidly, growing toddlers rapidly, and growing humans quite rapidly to the point that our growth plates fuse in adolescence. Milk is filled with growth factors, all milk. Once our growth plates fuse, all those growth factors can help me grow horizontally, which I'd rather not do. They could also help me grow precancers and cancers, which I would rather not do. So if you're, but milk has a lot of protein in it, and humans began having milk about 10,000 years ago when we domesticated cows in Europe. And the Europeans developed a genetic mutation that let us digest lactose in milk. Most Africans don't have that. Most Asians don't have it. People of Caucasian ancestry usually have it. If you're fine with having cancer, fine with getting fat, drink milk. If you'd rather not have cancer, rather not get fat, I would get your calcium from greens and protect your bones by doing weight-bearing exercise, jumping rope, and a vibration plate. But again, milk does have protein, does have some calcium, but if you're fine with getting cancer, drink up.
Thank you. Terry from Facebook is asking if there was one thing to do to start on the right path of eating, what would it be? Meaning, what should I concentrate on adding to my already clean diet, which consists of no sugar and very limited processed foods?
I think a really lovely place to start is be sure that you have more green leafy vegetables. Learning how to have some sautéed greens. I think that they are my family's favorite vegetable, sautéed greens. Or you could have greens with some green grapes and ice and olive oil for green smoothies. Your kids would probably like that. And if you're open to eating meat, have it liver once a week, well prepared, is also one of my family's favorite meals. If you don't like liver, heart is a really great organ meat. Oysters and clams, mussels are a great organ meat as well.
Thank you. Bob is asking, why is the new trial focused on RRMS? I'm shortening it for now. And how were the results of the previous trials on people with primary progressive MS?
So the very first study that we did with primary progressive MS showed that people who are severely disabled, and the mean disability was between cane and walker, were able to implement our program, and that half of them had clinically meaningful improvement in walking. So if you have progressive multiple sclerosis, get my book and implement it. It could make a huge difference in your life. And think so. And why we limit to relapsing remitting MS? It's easier to recruit. 80% of people with MS have relapsing remitting multiple sclerosis. That is why the vast majority of studies are in relapsing remitting multiple sclerosis. We have that big study going on. We are now writing for multiple studies with progressive MS. I agree there is a huge need. People don't like studying progressive MS because notoriously nothing works. I've already shown that my approach works very well for progressive MS. So actually, I'm super optimistic that that we'll have success getting funding for a progressive MS study. So everyone with progressive MS who's on this call, please screen so you're in my database so you can hear when we are ready to recruit for progressive MS.
Thank you. Elizabeth is asking, is brain volume standardized enough? My neurologist doesn't agree.
So for research, yes. For clinical trials, absolutely it is. It's now considered to be one of the important measures that are followed in clinical research. For people in clinics, the question is, does your radiologist use a software that standardizes the measurement of brain volume over time? And so there are a number of softwares that are in place that will do that.
Thank you. Ronald is asking, do you have any results for people with, well, you already answered, primary progressive MS on the Wahls diet? And I know you said to read the book.
So read the book, read the book. I have answers. We have our very first paper showed our first two papers that came out looked at people with 10 with primary and secondary progressive MS, then 20 with primary secondary progressive MS. We could show that they implemented the diet, and it was diet, supplements, exercise, electrical stimulation of muscles, and meditation. So it was everything that I had done.
Mhm.
We reduced fatigue, improved quality of life, reduced anxiety, reduced depression, improved cognitive performance, so thinking, and we improved walking and hand function.
Wow,
That's pretty good stuff.
that's great. I mean, that's really great. We have somebody who raised their hand. Susan, I'm going to unmute you. Can you hear us?
Me? Hello.
Hi.
Yes. I wanted to know, Dr. Walls, I read your protocol early on. If you can follow the protocol without organ meat and use a less saturated oil.
So you can absolutely follow the protocol without organ meat. If you go to my website, terrywalls.com, there are organ meat capsules. And certainly we have a bunch of folks who elect to do the organ meat capsules instead. And you can follow a low saturated fat version of the diet, and I talk about that in my books. So absolutely, you can do that.
Thank you.
Thank you, Susan. Thank you, Dr. Walls, by the way. I know we're nearing the end of the hour. Are you okay to stay another 15, 20 minutes max?
How about we limit it to 15?
Okay, yes, we can do that. Did you want to share the slides?
Okay.
I know you mentioned that you would like to so people can have more information before we continue with the.
So let's see if I can. Okay, are you seeing my slides now?
Yes.
Okay, so again, it's 18 to 70, 156. It's the largest, longest diet study that will have been done. We're comparing the olive oil ketogenic, modified paleo to usual diet. We'll look at quality of life and clinical outcomes. You're also seeing a copy of the study brochure, and we're looking at brain volume. Can we get people to healthy rates of aging? So the key is you have to come to Iowa City. That is the email. That is the long version of how to join the study. But if you go to terrywalls.com, there is a link to complete the screening survey there. And we have the MS and Neuroimmune Summit. It'll be free online. More information will be available about how to sign up the week of June 20th. Sign up for my newsletter at terrywalls.com so you'll have access, because we'll send that information out the week of June 20th. And follow me on Twitter, follow me on Facebook. If you follow me on Instagram, you get to see what I'm eating and doing, and I think it's pretty fun. And I'll stop my share and come back.
Thank you. Karen is asking, what are the basic must-have supplements?
You know, so again, I've got these on my website. I think everyone should know what their vitamin D is and get their vitamin D optimized. And you want to take a vitamin D that also has vitamin K in it. I would know what your a couple grams of fish oil would probably be super helpful. We have multiple studies that show if you take between 1 and 4 grams of fish oil, there's a lower rate of relapse, a lower rate of the number of enhancing lesions. So I think that's very clear. And a B vitamin is probably also tremendously helpful. I would take an activated B vitamin that has, because all of our B vitamins will be activated. So depending on your genetics, my efficiency at that activation step will be normal or depressed. And I know for myself, I have several genetic variants on how well I activate B12. So I could have a high, what looks like a very high level of B12 in my blood, but I have a high homocysteine. And if I take the activated forms of B12, my homocysteine comes down and is appropriate. So, much better to have an activated form of the B vitamin. So if you have these genetic variants, it's less of a problem for you.
Thank you. Mary is asking, what advice do you have for someone older than 70? I am 78 and disappointed that I cannot sign up for your study.
Well, Mary, please read my book and implement as many of the concepts as you can. You can pick which of the diets speak to you, whether it's the ketogenic diet or the modified paleo diet. You can also sign up for my registry because some of our online studies that we've done uh, let people participate from anywhere in the world, and we don't have age restrictions. So, Mary, sign up for the registry so you'll be eligible for some of our future studies.
Thank you. Dean is asking, does your diet work for any neurological conditions like myasthenia gravis or epilepsy, or only for MS?
It's been very helpful for myasthenia gravis. It's been helpful for rheumatoid arthritis, inflammatory bowel disease, psoriasis, anxiety, depression. It's been helpful for cognitive decline, traumatic brain injury. So if you have a autoimmune or psychiatric problem or a neurologic problem, I'd certainly encourage you to implement the Wahls diet.
Thank you. Caroline is asking, what level of vitamin D do you recommend? And are there any concerns with the calcium level for people who also have osteoporosis?
So if you have, so it's sort of interesting. We've steadily increased the amount of calcium people should have in their diets, but I've asked people to have more milk. But when we look at epidemiologic studies, those societies that have the highest intake of dairy also happen to have the highest rates of osteoporosis. Now, association does not lead to causation, but that's certainly an interesting observation. People have osteoporosis or osteopenia. I want them to have sufficient vitamin D, sufficient vitamin K. So that's why I want you to have a vitamin D supplement with K and to have plenty of greens. And I want you to have weight-bearing exercise. There are a number of studies that have used vibration plate therapies that let us stand on a vibration plate and have gentle gravitational stress to our bones that have been shown to increase bone density in people with osteoporosis postmenopausally. I had severe osteopenia. I was not osteoporotic, but severe osteopenia that was documented in 2004. I was following a paleo diet at 2004. I had started that in 2002. I'm wheelchair dependent. Now, since that time, I have implemented the paleo diet. I've ramped up my greens. I'm taking vitamin D and vitamin K, and I periodically get bone mineral density. And my neurologist and my primary care doc are like, okay, you're older, you're 67 now, but every time we measure it, your bone mineral density keeps getting better and better and better. And that's because I also do vibration plate therapy 3 to 4 times a week. I have plenty of vitamin K, and I'm really committed to exercise, including strength training.
Thank you. Grandy from Facebook is asking, if someone with MS has been doing intermediate fasting with 16 hours on, 8 hours off, and 5 to 2, lost over 130 pounds only by doing the 16-18 ratio, what would you say about trying to add a dry fasting day a week or once a month?
Now, of course, that conversation you should have with your personal physician, and the decisions about am I going to use dry fasting? I look at all the person's medical comorbidities.
Thank you. Anonymous is asking, what are your thoughts or recommendations for sleep and exercise changes in conjunction with these diet changes?
So I think the question that's being asked is, should people do everything?
Mhm.
Should we fix our diet, fix our sleep, exercise, have some type of stress-reducing practice?
Mhm.
And the answer is add these to improve the self-care at the pace that will work for you and your family. Now, at various times in my life, I will I have focused on diet, and then I've began to pay more attention to meditation. Then I began to pay more attention to sleep. And where I'm and right now I'm really jazzed that I'm jogging again. So I'm paying more attention to being able to jog. And it can be really hard to implement everything all at once. Feels like, oh my God, that's like 2.5 hours a day, and I don't have 2.5 hours a day. So just begin improving things at the pace that is sustainable for you.
Thank you. Another anonymous question. I am pre-diagnosed, but my neurologist suspects it's MS with facial and leg spasms and high white blood cell count in CSF. What things can or should I be doing now to slow my progression? Once official,
Okay, we're going to stop there.
I'm
So, so, so people will have a variety of problems that may have fatigue, may have sensory disturbance, may have mood issues, and you're going to see your physician, and your physician is like, well, I'm checking the labs, there's nothing clear, I don't know what it is, and you're frustrated because you don't have a diagnosis. I'm thrilled you don't have a diagnosis because that means you're in the prodrome phase. That means that you're earlier in the disease process where it is more likely that implementing all of the concepts that I'm teaching here in my book, The Wahls Protocol, about uh, things you could do with your diet, with meditation, with some targeted supplements, with exercise, can begin to help your cells do the chemistry of life more correctly. That can begin to help you have a healthier microbiome that can reduce your oxidative stress. And I predict many, many people in that prodrome phase begin to have whatever the symptoms in the prodrome phase start melting away. And you'll go back to see your physician and you'll say, like, you know, I read this amazing book and it inspired me to start fixing my diet. And then I started feeling better. And then I started moving more. And then, I was feeling better. And my wife and I decided that we'd start going on walks together. And I'm happier. And I'm not as crappy with my kids. And you know what? I don't care I don't have a diagnosis because I'm not sick anymore. That's what I predict happens if you quit chasing the diagnosis and you start chasing how do I get healthier at a cellular level.
Thank you. The second question was, once officially diagnosed, is it best to jump straight to DMTs or keep with the diet?
If you are um, deciding between doing DMTs or fixing diet and lifestyle, this is a false choice. If you want your brain to have a chance to have healthy aging, the best way to do that is diet and lifestyle. It is a very separate decision. Do I want to do DMTs or not? And you can have that conversation with your neurologist who will insist that that is the only way to protect your brain. And you'll have to make your own independent decision. Some folks feel better doing DMTs immediately plus diet and lifestyle. Some decide, you know what, I'm doing diet and lifestyle and I'm going to wait on DMTs because I don't have many lesions. I don't have much symptoms. And I'm going to see if I can control everything with diet and lifestyle first. I'll get a surveillance MRI at 6 months, and that feels like the right thing. What you really have to look at is if you get the package insert and you see the long list of adverse events and how often they occur, and you see that on the adverse events there are a lot of mild things that are not too big a deal. And then there are some really terrible things that might kill you. And some people, and they're not very frequent, and some people are very afraid of these infrequent lethal problems. Some people are very afraid of, I don't want to become disabled, I don't want to be in a wheelchair, I don't want to be in a burden. You have to think, for you, which list of things that you are most afraid of, the disability risk or the rare but serious adverse event risk. And I'll tell you, when I was in the wheelchair and I didn't want to become a burden, I was like, okay, I'll take drugs that have a 2% chance of giving me acute leukemia. And I took them every month because I didn't want to be a burden. We all have to decide which risk you are most comfortable with.
Thank you. That was well said. Well, that brings us to the end of our time. If you missed any part of this conference, it has been recorded and will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for information on how to access the recordings or sign up for our newsletter to learn about upcoming events. Also, you'll be receiving a short survey when you leave the conference. We really greatly appreciate your feedback because it helps us determine what type of information is the most meaningful and helpful to you as the attendees of the conference. Our next teleconference will be this coming Tuesday evening, February 14th at 4:30 p.m. Eastern. Our speaker is Dr. Ben Thrower, who will be answering all of your MS-related questions in a town hall style Q&A. Come join us for Ask the MS Expert. Our sincerest thank you to all of our attendees for your participation, and especially to you, Dr. Wall. Thank you for taking the time out of your busy schedule to share this very helpful information. Good night, everyone, and we'll see you next time. Also, just wanted to let everybody know that the book that Dr. Wahls wrote, if you would like to, you can request to borrow it from your lending library. But there might be a wait list due to this program and her showing the book. So just keep an eye out and just stay patient. I will also be sending the link for the brochure to her study. And if you have any questions, please just respond to the registration email. Thank you so much. Have a great night. Bye.